anybody has the ability to record the meeting. If you, on your own computer, if you would like to do so, please notify us by using either the Zoom raise your hand feature, press the button, or raise or wave at us visually, and it will give you permission to record the meeting on your own computer. I would also like to remind people, though, that the official minutes of the meeting will be the minutes taken by the clerk that reside in the county clerk's office. With that being said, if you would join me in a moment of silent reflection before we get started. Thank you. Thank you very much. Now, if you would also join me, stand and join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're at item 4. The roll call, please.
Commissioner Nakagiri.
Here, Heartland Township, Livingston County, Michigan.
Commissioner Griffith.
Present, participating from Genoa Township, Livingston County, Michigan.
Commissioner Lawrence is absent. Commissioner Reeder. Commissioner Reeder.
My microphone up quicker.
Oh, there you are.
Okay. From Deerfield Township, Livingston County, State of Michigan.
Thank you. Commissioner Helserman.
Present from Handy Township, Livingston County, Michigan.
Commissioner Drick.
Present, City of Howell, Livingston County, State of Michigan.
Commissioner Zajac.
Present from Marion Township, Livingston County, Michigan.
Commissioner Gross.
Present from Green Oak Township, Livingston County, Michigan.
Commissioner Plank.
Present from Green Oak Township, Livingston County, Michigan.
A quorum is present.
Thank you. Item 5 on the agenda is correspondence. This evening we have 1, 2, 3, 4, 5, 6 pieces of correspondence from other counties. Looking for a motion to place on file.
Motion to place on file, Griffith.
Support Zajac.
The motion by Griffith, support by Zajac. Roll call, please.
Commissioner Griffith.
Yes.
Commissioner Gross.
Yes.
Commissioner Plank.
Yes.
Commissioner Lawrence is absent. Commissioner Reeder.
Yes.
Commissioner Nakagiri.
Yes.
Commissioner Helserman.
Yes.
Commissioner Drick.
Yes.
Commissioner Zajac. Commissioner Zajac.
Yes.
Motion carried.
Thank you. Item number 6 on the agenda is our first call to the public. Just a reminder, please use the raise your hand feature to let us know you would like to speak or just wave at us. You'll have 3 minutes to address the board. This is your opportunity to present information to the board. It is not intended to be a two-way conversation. And prior to speaking, if you would provide us your name and address for the record, Cindy will be identifying the order of speakers.
Ron Cardos.
Mr. Cardos, if you unmute yourself, you have 3 minutes.
Yes, thank you. My name is Ron Cardos, resident of Osceola Township. There's an article in the Livingston Post today that provided me some fuel for what I'd like to say to this body. The title was, "Who is Served by the County Commission's vaccine resolution. It starts out by commending the commission for recognizing finally that COVID-19 is real. It points out that numerous statements made by Livingston County leaders attempted to downplay the need to individually take steps to protect ourselves and others in our midst. It then goes on as follows, and I quote, "You see, while Livingston County has warmly embraced its position as Michigan's fastest growing, best educated, and wealthiest community, it's finding that the flip side of the coin, social vulnerability, is working against it as residents join the hunt for vaccines. This is where my thoughts come in. Now, and I say that boldly, is the time for this commission to see that this issue is not only important to the residents of Livingston County, but also to the larger population. We must think not only in terms of the virus spread, but also in terms of the overall impact on those communities in Michigan with populations that are less educated, less wealthy, and more socially vulnerable. The question of who is served by the county commission's vaccine resolution is never directly answered, but it would serve you well to make that determination prior to you vote on this resolution. I urge you to vote no. Thank you.
Thank you, Mr. Cardos.
Leanne Blajewski.
Deanne Blazewski.
Yes, hello. This is Leanne Blajewski. I'm from the city of Howell. And I just wanted to quickly comment that I support this resolution. And I'd like to answer that gentleman's question previously. Who would be served? The people of the state of Michigan who are in the senior elderly categories. Those are the people who will be served if the Michigan Department of Health and Human Services does the right thing and rejects the use of the Social Vulnerability Index, which is incorrectly being utilized in this situation. The Social Vulnerability Index was never intended to be used for rationing scarce vaccines, let alone rationing or making decisions about who is most in need of vaccinations. Now, regardless of whether or not people agree with being vaccinated or not, my point is that we should clearly focus on the people who are most vulnerable to having poor responses to the contraction of the COVID infection, which it's been well documented that the people most vulnerable are the people who are in the senior age groups, which is approximately over the age of 70, and also people who have serious existing conditions, comorbid conditions. So that's the focus that the Michigan Department of Health and Human Services should have, period, on how to keep the death rate and the serious complication rate low. Now, there's a lot of different ways, in my opinion, that can be done. But as far as your resolution, you're absolutely correct. This is a travesty on public health that they are misusing the social vulnerability score. And to the point of what the Livingston Post said, this is a travesty to people who are in the lower income brackets. They also have family members who are in those high risk categories, and their family members are not going to be protected with this misuse of this vulnerability index. So those communities should also not be happy about this. And so my point is, this is going to actually lead to more deaths. It's going to cost us more time in this pandemic. So I strongly agree with your resolution. Thank you very much.
Thank you very much, Ms. Blazewski.
Judy Daubenmire.
Thank you. My name is Judy Dovenmeyer, and I live at 4490 Lakeshore Court, Brighton, Michigan, in Genoa Township. And I come before you again for the second time in less than a week to oppose this resolution and to congratulate you on your newfound interest in COVID-19. And I do mean newfound, because as recently as February 12th, your political party was holding in-person breakfast meetings in area restaurants. Where was your concern for senior citizens who might have attended those breakfast meetings and been exposed to COVID? I didn't hear anything from you then, nor did I hear anything when the health department began vaccinating teachers. Why didn't you speak up then and tell them only to vaccinate senior citizens? I didn't hear anything when the health department was vaccinating first responders. I didn't hear you speak up and say only vaccinate senior citizens. Where was your interest then? Some of you have been traveling around the county to township boards, trying to stir up resentment over this scarce vaccine. And you've been basing your argument on the insinuation that some people in Detroit are getting this vaccine instead of the people in Livingston County. I think you need to investigate vaccination rates around the state. In fact, it's people in the UP who are receiving vaccinations at a 28% rate in counties such as Schoolcraft. But I guess it doesn't serve your politics of resentment to talk about undeserving Upers getting the vaccine when you can be talking about people in Detroit. I think you need to be honest about where the vaccine is going. If you really are concerned about COVID, you need to remind people that even once they are vaccinated, they need to continue wearing masks and socially distancing. And you need to encourage everyone to get vaccinated. Livingston County has one of the highest rates in the state for people who refuse to have their children vaccinated at school. As high as 30% of the children in some of our schools refuse vaccinations. Will you be encouraging everyone to get vaccinated, including those who refuse to vaccinate their children, so that we can indeed have widespread immunity to this disease at last? And since you care so much about public health right now, how about a moment of silence at some point for the 138 people from Livingston County who have died at this disease, even as you have discouraged mask wearing and social distancing? I don't believe you've ever acknowledged any of those deaths. If you want to pretend that you care about public health, you need to do a better job of acting, because right now you're not fooling anybody. Thank you.
Thank you, Ms. Dovenmeyer.
Lynn Vogel.
That was the woman.
Lynn Vogel.
Hi, here's a picture of me and my name and where I live. Since I've only got 3 minutes to respond to this resolution, I'm going to be quick, so listen up. I just want to start by pointing out the hypocrisy of getting upset about masks and lockdowns and now thinking that we deserve more vaccines. All right, let's do data. The CDC says that 8 out of 10 COVID-19 deaths reported in the US have been in adults 65 and older. That sucks. So what if we prioritize by 65 plus only? Livingston County ranks 11 because y'all are old. Is that the way we should be prioritizing this stuff? Nope. Why? Let's use an example. Here's a sad old guy. Which one is more likely to be infected with COVID? A sad old guy at home, or B, a sad old guy in public transportation? If you answered A, congratulations, you're wrong. Why? If sad old guy A can stay at home and have his meds delivered to him instead of having to take public transportation to pick it up like sad old guy B, A has a lower chance of catching COVID-19 because he's not exposed to all the potential carriers on the bus. Now, Mr. Nakagiri has rightly pointed out that one of the most important factors associated with COVID-19 mortality is age. But what's the chance of dying from COVID if you don't get infected with it? 0. That's right, 0. That means a lower chance of getting infected will lead to a lower chance of getting dead. But what lowers infection rate? I'm glad you asked. A University of Michigan research team examined the association between county-level social vulnerability characteristics and weekly cumulative COVID-19 incidence and mortality in Michigan from March 25 to July 29, 2020. Here are the key takeaways. Every broad domain of social vulnerability was associated with COVID-19 incidence and mortality in Michigan, including household composition, socioeconomic status, housing and transportation, and minority status. Now, remember, this is including both incidence, which means infection, and mortality, which means dead. Taking all of those factors into account, Livingston County is rated as the safest county when it comes to COVID-19 risk of infection and mortality. Yeah, that means we're prioritized last because we're awesome.
But why are we counting minorities?
You know what? Let's pretend like we're super racist and ignore minorities and non-native English speakers. We're still at the bottom of the list. In fact, we are the county with the least risk due to socioeconomic status at rank 83, minority and language at rank 80, and housing and transportation at rank 82. Not to mention, if we go with every subcategory in household composition instead of just focusing on 65 plus people, we're still at the bottom of the list. The only time Livingston County increases in priority is if we prioritize people who are 65 years of age or older and ignore the increased risk of exposure felt by the poor, unemployed, uneducated, young, disabled, single parent, minority, non-English speaker, multi-unit dwelling, mobile home dwelling, crowded living space dwelling, non-vehicle owning people, all of whom experience an increased risk of exposure because of those factors. In conclusion, I actually really like old people. My dad's an old person. Y'all are pretty fun. But if one of y'all needs groceries, please let me deliver them so you don't have to risk exposure. But most importantly, let's make sure to take care of the most vulnerable people in our society first. Thanks. I yield my time.
Thank you, Mr. Vogel.
Caitlin Perry Dial.
Thank you. That is a hard act to follow. My name is Caitlin Perry Dial. I live at 634 Nelson Street in the city of Brighton. And I'm addressing the board today to ask you to please reject this resolution. As we noted in this previous presentation, the SBI is a needed index to distribute vaccines fairly. However, I'll just make my quick points. This resolution misrepresents what is going on. The health department allocation is a very small part of how the vaccine is being distributed. Furthermore, Dr. Fauci has even said that the vaccine supply is increasing daily and that by April, it should be open season. I actually heard on a podcast earlier today that he said that it should be available. He thinks it should be available to everyone by June. So I think we're doing all right there. Some other things to consider. Vaccines sent to the county health department are a minor part of the vaccine distribution plan. Far more vaccines are being just distributed through pharmacies, including Myers and Rite Aid. My own in-laws, who have no prior health concerns but are ages 67 and 69, got their first vaccines at Rite Aid last week. That's a great thing, and they're here. So this resolution is unnecessary because the SBI is working. As we learned from Lynn's fabulous presentation, we're doing okay here in Livingston County. This resolution clearly, by looking at some of the factors that Mr. Nakagiri has pointed out, is racist, classist, and really shows the cards here on what's important here in Livingston County, which clearly this board thinks it is elderly white people and not those who are vulnerable and could truly have serious health complications due to COVID-19. Thank you. I yield my time.
Thank you.
Diane Davidson.
My name's Diane Davidson. I live in Deerfield Township. And I would like to say to the board today that the Livingston County resolution calling upon the governor and MDHHS to retract their SBI social factor-based plan and replace it with a scientific model, medical factor-based plan that results in a pro rata uniform distribution to Michigan's most medically vulnerable population, states that, and I quote, "It is generally accepted based on the commentary from the CDC and the state of Michigan, the population most vulnerable to COVID-19 are those 65 years of age and older," end quote. What this resolution fails to mention is that our county is predominantly white and upper middle class, and that while we have a significant number of seniors in the 65 and older age range, they are not at the same risk as seniors in neighboring counties whose race puts them at a disadvantage due to geographic, historical, and medical disparities. I'm 75 years old, and I want to get the vaccine as soon as possible. but not before my fellow citizens who are at greater risk than I am. Statistics tell us daily that African American and Latino populations, like those in counties all around us, are dying at a younger and a much higher rate than we older white people. Michigan's most medically vulnerable population, as the resolution states, is not white over 65 people often living alone, but people of color living in lower economic areas who are required to work in essential jobs outside the home and whose living situations are often multi-generational. Science and data repeatedly tell us that there are more vulnerable populations than ours at risk of death from COVID-19. I would like to see Livingston County be a model county in Michigan. I would like us to demonstrate what good citizenship really is instead of embarrassing ourselves with these kinds of resolutions. All we accomplish is a public display to the rest of the state that we are a selfish, self-serving county crying foul because we didn't get what we wanted. I urge the commissioners to vote no on this resolution. Thank you.
Thank you, Ms. Davidson.
Dee Fialka.
Hi, can you hear me?
Yes.
Yes.
Oh, hi, my name is John Fialka. I live at 10485 Lakeshore Drive in Tyrone Township. I just wanted to call attention to a proposal for a rezoning in Tyrone Township. The township is being asked to change the zoning to allow for an asphalt plant. And there's a number of health and safety concerns that the citizens of Tyrone Township especially are concerned over and vehemently opposed to it. We've started a Facebook page. We have over 2,800 members, and we have a petition with over 3,800 signatures. So there's not a lot of support among the community at Tyrone Township for this asphalt plant. And we just wanted to bring that to your attention. Thank you.
Thank you.
Leo Hannafin.
This is the doctor.
Yes, I am Dr. Leo Hannafin from Brighton Township. Last Thursday, I heard our county officials demeaning immigrants and arguing against the use of the SVI index that favors Michigan's most vulnerable. They demonstrated their lack of understanding of the core principle of our nation, that all men are created equal and they're endowed by their creator with certain inalienable rights, the very first of which is life itself. If I'm not mistaken, all of you commissioners are descendants of immigrants. So am I. My Irish and German ancestors didn't speak English when they came to America, nor did my wife's Italian and Romanian ancestors. My father-in-law is Giovanni Papa, the Italian, and his parents didn't speak English when he fought in World War II against the Italians. Those of you who think non-English speakers are not American offend the memory and contributions of Giovanni Papa and all of our ancestors. You should be ashamed. If you look at the 1939 government housing map in Detroit, you'll see that the area right next to UD was colored yellow for, quote, definitely declining because of the, quote, threatened encroachment. Italians from the red area southeast, some higher income families moving out, end quote. This is right where Giovanni Papa grew up. Of course, if you're Black, you probably lived in the red hazardous areas. Maps like these came from policies that defined the future for entire races. Loans were denied to Blacks in red areas. Home values dropped and there's no appreciation. Black families couldn't build the wealth to trade up to the suburbs like ours. They were being financed with massive federal dollars for low interest loans and highways. Investments that helped whites only. It's like welfare for whites. As a result, housing values in Detroit plummeted, driving funding and quality of schools down. Investments from grocery stores to healthcare facilities were made in the suburbs, not in Detroit. The data clearly shows that all of these factors have led to increased vulnerability of COVID-19 in areas like Detroit and Flint. And it's important to note that the death rates from COVID for Black areas of each age blacks of each age range are that of whites 10 years older. Data conveniently ignored in the county's resolution against the use of the index. It's time Livingston County shed the mantle of racism and anti-immigration words and policies, starting with the rejection of this motion. I also urge that each of you to study and recognize the deep roots and continued existence of racism in our country and in our county. Diversity is coming. It's time we all understood its benefits and embraced it. Thank you.
Thank you, Mr. Hannafin.
Timothy Schnell.
My name is Tim Schnell, and I live at 121 Victoria Park Drive in Howell. I urge you not to adopt a resolution relating to the distribution of COVID-19 vaccine. First and foremost, the resolution rejects the state plan as unscientific. That assertion is incorrect. Use of the Social Vulnerability Index is designed to measure relative health risk from one geographic area to the next. It is not social engineering. Instead, it's used to obtain the best outcome. It uses age as only one factor because there are many other factors which contribute to the relative levels of risk. The evidence indicates that the SVI strongly correlates with the geographic areas in Michigan which have experienced the highest COVID-19 infection and death rates. Livingston County cannot effectively isolate itself. Actions which control infection in the surrounding counties protect us too. It is the resolution's proposed method of allocation which is unscientific because it considers only the relative numbers of elderly persons. In Livingston County, we generally have good medical care and can socially distance more easily, so our risk of spreading the virus is lower. Further, the resolution's advocates assert that the state has failed to adhere to its tiered plan for vaccine distribution. However, the priority rules determine which individuals are eligible to be vaccinated, while a plan for geographic distribution of the vaccines using the SVI is a measurement of where the risk is the greatest. If my home is on fire, the fire department should first attend to my house rather than to that of my neighbor, even though that neighbor's home may be at risk if the fire continues. That priority has nothing to do with the fact that in both our homes, children will be rescued first. Finally, I'm concerned about the negative effect which this resolution might have on the county, both socially and economically. Bias on the basis of race, ethnicity, religion, gender, age, economic status, or physical attributes can be in the form of overt hate or in the form of stereotyping the attributes or attitudes of a group or its members. Most concerning, however, is bias which is unconscious. We all exhibit such bias. The only weapon we have is an acknowledgement that such bias exists, combined with careful logic and analysis. The adoption of this resolution will be perceived by those outside the county as founded in bias, regardless of the stated reasons, because it is not supported by the science and will have a negative impact on the social and economic well-being of the county. Thank you.
Thank you, Mr. Snell.
Marie Jopik.
Hello. My name is Marie Japik. I live at 6829 Chambers in Pinckney, and I also do not want to see this resolution pass. Just like the other people said earlier, I'm surprised the commissioners even brought it up when the commissioners have not encouraged people to wear masks. The sheriff is proud to say he's not going to even enforce the rules. There was no forward thinking about this COVID. Now, all of a sudden, you want this resolution. And like Diane said, if you look at the daily rate of people dying in Livingston County, it's very low. You compare it to the counties that are at higher risk, you can see that one county had the same number of deaths that we had just reported of cases. So our county is very safe. I am old, my husband's old, but we're able to drive to Myers, get curbside picked up. We have the ability in Livingston County, because we do better in Livingston County, to be able to isolate ourselves. As some of the other people pointed out, if I lived in Detroit, I have to take a bus. So at my age in Detroit, I would be at higher risk. I wouldn't have a car. I wouldn't be able to go to Myers and do curbside pickup. So for once, Livingston County, like the other person said, should be role model, and how we having the advantage of having a low risk, having the advantage to be able to socially distance and be able to support one another. We should be able to say to Michigan, we believe that the counties that have the highest risks deserve these vaccines, and we are able to social distance and can wait. I know I am more than happy to wait my turn. And I think that we should, at least as a role model, do it. Otherwise, like Diane said, we're once again showing Michigan that Livingston County is all about me, me, me. And I am done. So thank you for my time.
Thank you very much.
Paul Funk.
Paul, you need to unmute yourself.
That would help. Sorry. Thank you, Chairman Nakagiri. Paul Funk, 1840 White Cliffs Drive, Osceola Township. Regarding the resolution tonight, I commend the commission for the thorough analysis of the state's approach. I've shared it with friends all over the state. No one has seen that kind of analysis. Everybody expects that the most vulnerable will get taken care of. And there is a place for some discern between the various elements of the SVI. So while no one, including me, would not want anybody in a protected class and or a high risk segment of our society not have access to the vaccine, if they want it. And the other night in around town and recently at a breakfast in a restaurant where we were wearing masks, and at an event on Saturday where we were wearing masks, I heard people say things like Livingston County is systemically or racially biased, and this whole resolution is all about politics. However, when the CDC continues over and over and over again to say the starting basis is that the senior population is the most at risk and most vulnerable, it's only natural and appropriate that our local elected officials challenge a process that is clearly systemically biased against one of the protected classes. So I commend you for taking a look at it. The solution is somewhere in the middle. Keep up the good work. Thank you.
Thank you, Mr. Funk.
Dan Huff.
Thank you for the opportunity to speak. My name is Dan Huth, and I am from 1107 Brighton Lake Road in Brighton, Michigan, city of Brighton. And I want to take this time. First, I do actually want to apologize. My daughter is right next to me coloring, so you hear some cooing and noise making. That would be her. However, I just want to take this time because I wrote on February 17th, I wrote to my commissioner, Commissioner Lawrence, who I'm really pretty upset that is not here today to make her and her constituents' opinion heard on the matter tonight. And so because of that, and because of all the really well thought out positions taken tonight, I just want to read the letter, and I'll edit the parts that are specifically, addressing her by name and whatnot. But I just want to take this time to rally each and every one of you, since my commissioner's not here tonight. I'm writing you to urge you to vote against this resolution regarding the SVI. I believe that utilizing the SVI is helping our state curb this awful virus by ensuring communities without the benefits of the other available avenues have a chance to be vaccinated. As for the majority of Livingston County's senior population, I would be much more supportive of a resolution and an awareness campaign urging those 65 and over to put their names on every available list, Myers, CVS, IHA, U of M, et cetera, et cetera. After listening to the latest report from our health department, it is clear that has always been the quickest path for our aging population to receive this life-saving vaccine. After hearing and reading Chairman Nakagiri's comments on this matter, this resolution is nothing more than a thinly veiled dog whistle for those looking for a boogeyman that will do nothing in the end other than further divide our county politically. Please oppose this resolution and work with our state and county health departments to raise awareness on all of the options our citizens have available. Respectfully, Dan Huth, Brighton City resident. I yield the rest of my time.
Thank you, Mr. Huth. I would like to mention that Commissioner Lawrence is on a long-standing prearranged vacation. I know if that were not the case, she would be here. So thank you. Next.
Jessica Garcia.
Hello, my name is Jessica Garcia. I live at 327 South 3rd Street in Brighton. I come to you today as a resident, but also in my professional capacity. I have a PhD in sociology. I'm also a diversity, equity, and inclusion consultant around the state of Michigan, including for the state of Michigan. What I want to bring to your attention today is to highlight for you the issues of equity and why the Social Vulnerability Index matters. What we know is that more than half of Americans have at least one chronic health condition. Rates of infection are significantly higher in Black, Latinx, and Native American communities. More than half of Americans have been financially impacted by the shutdowns. Women, people of color, and the LGBTQ community, as well as our immigrants, are more likely to be essential workers and are also more likely to be laid off during this time. Access to healthcare, sick leave, opportunities to work from home, the ability to buy groceries in advance, and practice social distancing are all tied to socioeconomic status, race, gender, and citizenship status. What we learned last week is that in addition to being more likely to be infected, we've seen significant disparities in who's most likely to die from the disease, such that life expectancy of the Black population declined by 2.7 years in the first half of 2020. From the New York Times reporting slicing away 20 years of gains. The life expectancy gap between Black and white Americans, which had been narrowing, is now at 6 years, the widest it has been since 1998. The other issue that's come up that many states around the country are grappling right now is what to do with the COVID long haulers, who at this point now need to file for disability benefits. When you think about the Social Vulnerability Index, it's important to understand not just who's most vulnerable if they get infected, but who's most likely to be exposed, who's most likely to be able to isolate, but also then who's most likely to recover and recover fully. If the humanitarian side of this does not appeal to you, and I understand this as a DEI consultant, that not everybody cares about the human side of this. If you care about the financial impact, what the CDC describes in terms of the Social Vulnerability Index is that its purpose is to reduce social vulnerability by decreasing both human suffering as well as economic loss. If you're thinking about our essential workers and who's most likely to be in our businesses working on the front lines, these are also the folks from marginalized communities. And if they get infected, they can't come to work. And if too many of them get infected, the business has to shut down. And if they have long-term issues, that business has to figure out what to do with disability benefits. I ask that you deeply consider the impact of the decision you're making, whether it's from the humanitarian side or the economic side. It is a terrible decision. And as many have mentioned, the optics are not good either. Thank you.
Thank you.
Lana Tice.
Hi, everyone. Lana Tice from Brighton Township, State Senator 22nd District. I want to commend Livingston County's commissioners on this. Our seniors are getting shortchanged by this administration through the vaccine distribution. And our commissioners are trying to speak for their constituents. They are hearing, like I am, emails and phone calls over and over and over again that our seniors want to be treated fairly, that our constituents want to be treated fairly. They want access to the vaccine like all the other seniors. The data is true. 81% of the people who have died from this virus were 65 and over. Less than 5% are 49 or under. The need for us to take a look at that, for us to address our residents as representatives of our residents, is absolutely necessary and absolutely essential. I understand where these other people are coming from and what they're saying with respect to the other areas. Yes, absolutely, those things need to be considered. And our seniors want access to their vaccines as well. So I commend you for bringing this up, for advocating for your constituents, and I pray that the administration sees the error of this direct bureaucratic approach, which is how I see it. And I hope that we'll be able to get access to the vaccine for the seniors who want it. For those who are at risk who want it, they should be able to access it as soon as possible. And thank you for your time.
Thank you.
Kay Franco Kerr.
Hi, my name is Robert Kerr. I live in Tyrone Township, and I'm speaking in opposition of the proposed rezoning for the asphalt plant at Center Road and US 23 based on the negative impact on traffic, environmental, property values, and quality of life. This type of operation is not consistent with the current rural setting of Tyrone Township, which is a reason that many of us have chosen to live here. And I ask that the board, if and when this proposed rezoning comes to your attention, that you vote against it. Thank you.
Thank you.
David Hallinan.
Hi, guys. I live on 9669 Harmon Lane, South Lyon. It's actually Green Oak Township, Livingston County, whatnot. So I guess I have at a high level, I have a totally different perspective than many on this call, and that is I choose not to live in fear. My parents are quite old, 79 and 81. My mother's a breast cancer survivor. We have a very large family. They attended a Thanksgiving dinner that had 58 people there. And we make no effort when we're amongst ourselves to social distance, wear masks. We live 100% the way we always have. We do get COVID. My wife had it. I had a very minor case of it. I was tested positive with antibodies through a Red Cross blood donation. So I know I had it. I might get it again with or without the vaccine. But I choose not to live in fear. A lot of people here have talked about the so-called science. When it comes to Governor Whitmer, it's political science and polling data. And the reason I say that is when you look at how these state guidelines flip-flop faster than Fauci can flip-flop. During the holiday season, some states said you could have a gathering with as many as 8 people, and some states said with as many as 10, and some said 25. It's all hogwash, people. There's no science there. They're just pulling numbers out of, they're making it up. When we look at Michigan, we tend to get all hot and bothered. But when you compare other states that are open, South Dakota, Florida, and even comparing Florida to California, Florida is essentially at the same level of everything as California, and California was extremely locked down. But California has a lot of negative baggage with all their lockdowns. These other states have chosen not to live in fear. If you want to wear a mask, wear a mask. If you want to avoid crowds, avoid crowds. But, you know, other people want to live and other people need to live, especially the children. One code word that we hear a lot here is code words for illegal immigrants. Illegal means they're breaking the law. When it comes to the liberal community, illegal immigrants appear to be above the law. They're a special class. They're allowed to come in here. Biden's opening up the border. There's tons of people coming in. They're not getting tested. They're highly unlikely they have the vaccine. And Biden's saying, come on in, people. That's insane. That's absolutely insane. Now, with regards to the county commissioners, several other people said it. I'm going to repeat it. It would be irresponsible for the county not to represent the people.
Yeah, 15 seconds.
That's the whole point of having a local government, is they represent us. So, Wes, keep going. The rest of you commissioners, I don't know the rest of the commissioners, keep going. It's the right way to do it. Thank you.
Thank you.
Karen, the iPad.
Hello, my name is Karen Pierce. I live at 2299 Sosna Drive in Pinckney, Michigan, Livingston County. I had used up my 3 minutes, to address the committee on Thursday evening. So I'll just have a few words this evening to voice my opposition to this resolution that now has a number, 2021-02-029. I do not believe that this resolution is good for Livingston County in any way except to perpetuate our reputation that we are not an open and accepting community. I understand the frustration with the vaccines not coming to the Livingston County Health Department, but as we've heard tonight, there are many other resources for seniors in Livingston County to get their vaccines. I would ask the commissioners to really consider their motivation behind this resolution. And I would say to Mr. Hallinan's remarks that I live in Hamburg Township, in the part of Hamburg Township that is in Mitchell Zajak's district. And so as a constituent of Commissioner Zajac in particular, he is not representing my views. I am opposed to this resolution, to the picture it paints of our county, and for the unnecessary divisiveness this causes in our state. Thank you.
Thank you, Ms. Pierce.
Lance Schumacher.
Thank you. One thing that I hear a lot of, that by the county commissioners voting for this resolution, that they're going against teachers and first responders and essential workers, and they're also calling immigrants and non-speakers non-Americans. That seems to be the case here, but that's what everybody seems to think, but it's not the case at all. The fact is that this SBI, there's 15 factors in the SBI, and if it was all equal, that would be one thing. But because several of the factors are weighted, it makes it unequal and unfair. So I think that that's the key here, is that it's unfair. It's an unfair measure. Everybody, it's not really scientific when you start weighting certain factors, and that's the problem. So I think that by part of the problem here is that there just isn't enough vaccines, and there isn't even enough vaccines in this county to take care of the 1A group, let alone the teachers and the first responders and the essential workers. So I think by supporting this resolution, I'm hoping that this will at least get the governor's attention so that we can maybe get some more vaccines that we need in this county. Thank you.
Thank you, Mr. Schumacher.
Rose Foster.
Hello, thank you for letting me speak tonight. I live at Center Road here in Tyrone Township, and I wanted to let everyone know that I'm very opposed of the rezoning to M2 for the property at Old 23 here, allowing the asphalt and warehouses to come in, health issues, home values, traffic. Everyone fears all of this, and we just want to let it known that we are very concerned, and we're hoping you hear our concerns as well. Is there an email address that we could address your committee on our concerns as well?
Yes, there is. I'll break the rules here. Commissioners, plural, commissioners at livgov.com.
All right. Thank you.
Thank you, Ms. Foster.
Yep. Have a great night.
Megan Reckling.
Good evening, Commissioners. Megan Reckling. I live at 620 North Kane Road in Handy Township. I would like to thank the Commissioners for taking this up tonight. It's definitely been a confusing signal that the administration has sent the residents of Livingston County. A year ago, the governor shocked us all when she moved Livingston County from the emergency preparedness region that we had been in for a long time with counties like Ingham and others to another region with counties like Oakland, Wayne, Genesee, and Macomb. And she did that because she sent the message that Livingston County should be in top priority with those other counties in Southeast Michigan who were seeing massive outbreaks of the coronavirus. Now the residents of Livingston County are being told when it comes to vaccine distribution that they rank 83 out of 83. Even if we want to look at those who are being benefiting from the SVI index, minorities, those who live in mobile homes, the residents of Livingston County who qualify under the SVI index are still being ranked 83 out of 83. So someone who's a minority living in Livingston County is still being told they are last on the list and not important. I thank the commissioners for representing those who live here who have expressed their frustrations. I myself have received calls almost daily from seniors who are incredibly frustrated. They have, they're really struggling to get access to the vaccinations that they feel they should deserve just like everyone else. So I thank you all for speaking for them, for being their representatives, and for listening to their frustrations and their concerns. I urge your support on this.
Thank you.
Keith Van Houten.
Keith Van Houten, Four Seasons Drive in Heartland Township. I'd like to urge you to vote against this proposal. This is a ludicrously simplistic proposal that you have before you. Risk, in fact, is multifaceted and it is unbalanced. The previous commenter commented on that. Some factors are weighted more than others. It's ludicrous to suggest that this board has the level of expertise required to assess that risk. We have a Centers for Disease Control, and they've put that forward. You should be following that. If there was true concern about getting the vaccine to the highest at risk, we would see proposals like, let's get enough virus for everyone at 1A. At the last meeting, Lana Tice cited that there were 10,000 people that are in group 1A that haven't been vaccinated, yet no proposal for those people. My son, less than 65 years old, with a serious chronic disease, immunocompromised with heart and cardiac involvement, living in a congregate living facility. No proposals for anyone like that to get the vaccine. Just a pure age-based kind of complaint about not getting enough vaccine. It's complicated. I urge you to vote against this. Thank you.
Thank you, Mr. Van Houten.
Denise.
Hello, Denise O'Connell, Heartland Township, Livingston County. I want to just say thank you to the commissioners for considering this. I hope that you will support this resolution. As we know, for the most part, our senior population is the most vulnerable. They deserve to have those vaccines available to them, and it's not happening. We've been told for months to follow the science. The science shows that it's the seniors 65 and over that need the protection. Please do everything you can, and I completely support your consideration of this resolution. Thank you for your time.
Thank you.
Jim Lee.
Hi, my name is Jim Lee. I live on Driftwood Drive in Deerfield Township. I'm just speaking up in reference to my opposition to the asphalt plant that is proposed to go in at Center Road and 23. You know, we've heard a lot of little different information on it, but between the health, the safety, the road deterioration, the possibility of housing values going down, which would mean housing tax bases would go down. Just very, very opposed to it. Besides the fact of it's right on 23, so you know, coming south from up north, the first thing you would see is welcome to Livingston County, and the first thing you'd see is a 174-acre asphalt plant. That would be just great for our community. So again, just wanted to jump in and on with what other people have said in reference to I oppose the asphalt plant. Thank you.
Thank you, Mr. Lee.
Mona Shand.
Good evening, commissioners. I live at 4852 Oak Tree Court in Brighton. A few days ago, I was on a webinar that was hosted by the Livingston County Chamber Alliance, which featured the Chief Medical Officer for St. Joseph Mercy Livingston, Dr. Varsha Mukul. Somebody asked her about this resolution and about the shortage of vaccines and referred to vaccines as the first line of defense against COVID-19. She quickly replied that vaccines are not the first line of defense, that social distancing and mask wearing are in fact the first line of defense against this disease. In this moment of real scarcity with this vaccine, while we work through these issues, I urge you, rather than pitting vulnerable populations against each other, to focus on mask wearing and social distancing. Things will get better with the vaccine supply. We know that is in the process. And no one is suggesting that Livingston County seniors should not be vaccinated. But in this moment of scarcity, I urge you to leave the public health to the public health experts. Thank you.
Thank you, Ms. Shand.
Are there any others who would like to speak? Please wave and I will thank you. I see you. Jane Suarez Forward.
Can you hear me?
Yes.
Okay. My name is Jane Suarez Forward. I live in Brighton Township, Livingston County. I haven't heard too many people actually have someone in their, I think one gentleman maybe, actually have people in their loved ones who have actual comorbidities. My husband, Larry, is 74, almost 75 years old, and he has two comorbidities. He has a heart condition. He's going for a 3-hour stress test tomorrow. He's wearing a heart monitor as we speak. He had colon cancer 1 year ago, and you know, cancer can always return, so we're always on the lookout for that. And he signed up for a vaccine with the Livingston County Health Department. Walgreens, he signed up, Myers in Brighton, both those two pharmacies, and through the primary care doctor at the hospital and through his cardiologist at Beaumont, no vaccines. So I was thrilled when the governor announced that age 65 and older could get a vaccine. And now she keeps moving the goalpost. And that's the problem with the administration, is that the plan keeps changing. And now we have all these frontline essential workers who have jumped the line, and they're all in front of my husband. He's now down to group 1C. And this is very disturbing. So I am in full support of what the Commissioner Zajac and Nakagiri have put forth. And I would recommend that all the commissioners vote in favor of this proposal tonight, this resolution tonight, because, you know, they are hearing from their constituents through emails and phone calls. And Senator Theis, she's hearing from the constituency. And all the other activists that are on the call tonight, That I'm sure was by design. I don't know. I don't like this to be political, but I'm telling you, you're hearing from a real life human being who's got a husband who needs the vaccine. I would feel a lot better. Remember, he's not the only person that lives in this household. There are other people that are younger that come into the household that we have to worry about them bringing it to him. So it's not like we're in a little bubble sitting here. I have to go out and get things as well to keep this home running. So this is a very serious that we're not getting our fair share of these access to these vaccines. So something needs to be straightened out in Lansing, and I'm very proud of what our commissioners have done about this and bringing it to the public's light. And I'm proud of that article that Commissioner Zajac wrote that was published that I read, and I'm impressed. Thank you. Thank you.
Connie Robinson.
Yes, I live in Heartland, and once again, I submit that this became political when the governor chose to unfairly weight this. It did not become political when we pointed that out. I have a sister who is in Meadowlodge. COVID has swept through that place with over 50% of the population getting it. She got it. She got very sick, ended up in the hospital for a week and almost died. So I strongly agree with this resolution, and I strongly urge every commissioner to vote for it. Thank you.
Thank you, Ms. Robinson.
Nancy Durant.
I hesitate to do this because I talked last time, but I'm going to respond to a couple of people. Most people know I'm a nurse. I'm also a hospital administrator. I'm also a vaccinator. And I'm not going to talk too much about all of those roles, but I'm also going to talk about being a mom. I'm going to talk about being a mom of a person who tonight, there's going to be tears, is the only intern chaplain at University of Michigan hospitals. He is a person who has asthma, who has ulcerative colitis, and who is 31 years old. He did get a vaccine. He probably did step in line against somebody else. As I said before, I also am an asthmatic. I did get a vaccine because I was in a vaccine trial. I have a husband who has high blood pressure, and he works for University of Michigan Medicine. So there are 3 of us in our home that have all been vaccinated. And yes, if you look in our subdivision, we are the only house that probably has been vaccinated that looks like we don't need to be vaccinated. I also know of a dear person today who is a Lutheran pastor who has been sick, who today told me that she got vaccinated. She's worked for 2 parishes, and she texted me that she was able to be vaccinated today. She got vaccinated because there is more vaccine in Wayne County. And she's a single person. She lives by herself. I took her to the hospital for 2 surgeries, and she's a dear friend of mine. So please understand that, yes, there are some of us who look like we've jumped in line. There are also people in our subdivision. There's 29 of us. Most of us are over 65. I'm 66. And the majority of us have been vaccinated. There's only 10% that have been vaccinated through the Livingston Health Department. I just talked to one of our neighbors. His wife was vaccinated through Macomb County, through Ascension. We've had people that have been vaccinated through IHA, through St. Joe's, through Michigan Medicine. So the majority of the people in our subdivision aren't getting their vaccines through Livingston County Health Department. And that's to be expected. We also had one that was vaccinated through where I vaccinate at Washtenaw Community or Washtenaw Health Department. So what I'm saying is, as other people have said, is that I think a lot of the people are getting vaccinated through other means. And yes, our
You have
elderly
10 seconds.
vaccinated. So please understand that you will be vaccinated. And by the end of March, probably the majority of us will be. Thank you.
Thank you, Mr. Rance.
Are there any others who would like to speak that do not have the raise your hand function, if you don't mind just kind of waving and I can see you? Okay, Michael, Zach, I see you.
Can you hear me?
I can hear you.
Okay. Vaccinations is really a big problem around here. We're in one of the lowest areas of able to have this stuff to take care of people. And I'm not pointing any fingers on where that's coming from. Granted, we've had bad weather. One of my biggest concerns is the asphalt plant. I live on Runyon Lake, Carmer Road, 10177. And I really don't want to be smelling tar when I want to go out for a boat ride in the middle of summer. I think we really need to come up with a better solution, a new location, whatever. I don't think the revenues are worth losing all the people and property values that are going to decrease around this area just because they want another business here. Put it someplace else. Put it in swamplands where nobody cares what it smells like because it stinks anyway. You know, this isn't the right area with all the pristine houses and golf courses and stuff around. I just think it's a bad call. And I will pass it on to somebody else.
Thank you, Mr. Zach.
Thank you.
Ted.
Hi, thank you very much. Ted Mercé. I live on Hogan Road in Tyrone Township, and I see a resoundingly familiar theme throughout this whole conversation. And thank you, Commissioner, for letting me speak. We're all talking about our concerns over health hazards, and I just have to jump in and join all of my neighbors in Tyrone Township speaking about the asphalt plant. We're really concerned about the future of our township. We're really concerned about everybody's health and everything that's going to be compromised if an asphalt plant does come to Tyrone Township. I was a firefighter for almost 30 years from Wayne County, so I know what that area is like. And I can tell you that's why I moved to Livingston County. So for a variety of other reasons, we just want to make sure that the county commission is aware that we're going to be fighting this all the way. This is a really big deal. It's going to end up being in our backyards. And I know that a lot of people have brought the subject up. I'm not going to take up too much more time. I want to thank you for the moment that you gave me, but please think about this in the future. The storm is coming. We definitely are going to fight this all the way. So we'll talk to you about it in the future. Thanks.
Thank you.
Are there any others that would like to speak? Please wave. Commissioner Nakagiri, I do not see any other hands raised or any other folks waving.
Thank you, Cindy. Then I'll go ahead and close the call. Well, before I close the call to the public, I just want to comment because there's a number of citizens here regarding the asphalt plant. The procedure, the approval of the asphalt plant is solely in the hands of the Tyrone Township Planning Commission. The Tyrone Township Planning Commission will, ask for consultation from the Livingston County Planning Commission, but the Livingston County Planning Commission has no authority over the Tyrone Township Planning Commission. So I just wanted to share that little bit of information with you. It is really the Tyrone Township Planning Commission that has the jurisdiction over this issue. With that, I would like to, I'm going to go ahead and close the call to the public, reminding people that there is a second call to the public if they have some new thoughts or forgot something. We'll move on to item number 7 on the agenda, and that is the approval of the minutes, for meeting minutes dated February 8th and meeting minutes dated February 17th. I'm looking for a motion to approve both sets of minutes.
Motion to approve both sets of minutes, Griffith.
Support Plank.
We have a motion from Commissioner Griffith, support from Commissioner Plank. Are there any corrections or additions to the minutes? Hearing none, roll call, please.
Commissioner Griffith,
Yes.
Commissioner Gross. Commissioner Gross? We'll come back to him. Commissioner Plank,
Yes.
Commissioner Lawrence is absent. Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Gross,
Yes.
motion carried.
Thank you. Item number 8, tabled items from previous meetings. We have no tabled items, so we'll move on to item number 9, which is approval of the agenda. Is there a motion to approve the agenda?
So moved, Drick.
Support Helserman.
Motion by Drick, support by Helserman. Any comments? Hearing none, roll call, please.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent. Commissioner Reader,
Yes.
Chairman Nakagiri,
Yes.
Commissioner Helserman,
Yes.
motion carried.
Thank you. Item number 10 on the agenda are reports. Do we have any reports from any of our commissioners tonight? Any reports?
Chair, I have a brief report.
Commissioner Zajac.
Thank you. As the commissioners recall, in our last gathering, I discussed an upcoming opportunity to have some conversation with county legal with regard to streamlining the purchasing terms and conditions process. I would like to report that that was a very productive conversation. I did some learning in that process. It appears we have some mechanisms in place, but county legal will be working with administration to help streamline that process further for purposes of both our awareness and then awareness of the various departments. The second part of my report deals with the meeting that Commissioner Plank and Administrator Byrd and I joined in on last week with members of the education system here in the county, superintendents from Brighton, Howell, and private schools, as well as LESA, joined in really just to facilitate discussion. I'd like to report that was a very productive conversation. No action items, there's no to-do list, there's no agendas of that sort, but really an opportunity to open up lines of communication that I would encourage any other commissioners, if they're interested or have questions about that, please let us know. We will certainly at some point be having a follow-up discussion with that group. That's all I have, Mr. Chair. Thank you.
Thank you, Commissioner Zajac. Any other commissioners with any reports to share this evening? Hearing none, I have a report. I had emailed this out to commissioners, but I thought I would take a few minutes to briefly go over this tonight for, I think there would be interest on the part of the public. So I am going to, I haven't done this before, but I'm going to attempt to share my screen. I have a brief slide presentation talking about CDC protocol for vaccine rollout. So bear with me for just a minute here. Let's see. is my screen showing?
Yes.
Yeah.
So I did a little bit more research. I wanted to find out the latest and greatest. So this weekend I was surfing around. These are CDC's vaccine rollout recommendations updated on February 19th, 2021, just a few days ago. So of interest, the CDC recommends what to do, but it's the states that decide. It says, while CDC makes recommendations for who should be offered COVID-19 vaccine first, each state has its own plan for deciding who will be vaccinated first and how they can receive vaccines. So the key point in here is CDC recommends, but the state has final say. In the CDC presentation, which, by the way, I want to go back a few, that link is the link to where you could read it for yourself, so you don't have to take my word for it. CDC does not recommend, there's no recommendations made by CDC in terms of restricting vaccine access based upon the social factors, the 15 factors. They're grouped into socioeconomic status, household composition and disability, minority status and language, housing type, and transportation. As I think most people are aware, the first priority in the rollout of vaccine was called Phase 1A, that is healthcare personnel and long-term care facility residents. I don't think, I'm assuming nobody on this call, everybody on this call would likely agree that it is a priority. The second phase, Phase 1B, frontline essential workers such as firefighters, police officers, corrections officers. I'm not going to read the whole list, but frontline essential workers are part of Phase 1B. But also Phase 1B includes people age 75 and older because they are at high risk. And I emphasize that because they are at high risk. Phase 1C, people age 65 to 74 because they are at high risk. And that's been talked about much this evening. Our elderly population are at high risk. What is, in my mind, curiously absent from the state of Michigan plan is prioritizing people aged 16 to 64 with underlying medical conditions because of their increased risk. And then also in Phase 1C as other essential workers. So compare CDC's vaccine rollout recommendations versus Michigan's actual rollout plan. The CDC recommends using the medical factors that I just pointed out, not social factors. Therefore, Michigan does not follow CDC recommendations for vaccine rollout. The social vulnerability index, Michigan uses 15 social factors for vaccine rollout. Only one of those factors is recommended by the CDC. So this chart here on the left, these 4 columns, these are the 15 factors, these social factors. There are 15 listed here. And I've got a column over on the far right that describes whether or not that particular factor is included in CDC's vaccine rollout recommendations. You can see that the only one that has a yes is the age 65 and older. And just as a reminder, the CDC recommendations for the vaccine rollout, I've relisted here in blue. So I thought it was important to share that information. It was information, like that I said, it was updated on February 19th. And I had shared that with the commissioners via email, but I wanted to share it publicly tonight. So thank you very much. I'm going to stop sharing and we'll move on in the agenda to item number.
Mr. Chairman. Mr. Chairman.
Yes.
I have a presentation a report I'd like to give to.
Commissioner Helserman.
Okay, if I can share my screen. Let's see, I've got to get back here first. See if I can share my screen. Share screen. Okay, I believe that this is the one I'm looking for. Right, share. Okay, let me, can you see it now?
Yes.
Okay, as the other members of the board know, I have done this presentation for our county that shows the numbers for our county across the months. Now, this particular one is using the same source material, but this is the source for the state. This gives the state figures, the number of deaths across the state, the number of cases, the number of tests, the rate of positive tests, and then over here, this particular one I think is probably the most interesting here that I saw. I have been looking for what is the definition of an epidemic, and Wikipedia is the closest definition that I could find. And that definition is when there are, for a population of 100,000, that there are 15 positive cases per 100,000 that average over a 2-week period. And so this column right here shows that, but you can see that the number of deaths in the whole state were started medium in March, very high in April. Then the summer was much lower. And then beginning in October, there's a big uptick. December is the peak, but that was not even as high as the April peak. And the January is going down, and half of February is significantly less. But what I wanted to bring your attention to is this. This is the number of days in each month where that 15 cases per day average over a 2-week period. For the whole state of Michigan, there were no days like that in March that fit the definition of an epidemic. None in April, none in May, none in June, none in July. We have to go all the way to October before we get to, we have 16 days in October where that threshold was met. The second one, shows that the days that it was twice the amount. In other words, there were more than 30 per 100,000. This is more than 3 times, so that'd be over 45 cases average for a 2-week period, and this one is more than 4 times. So at least 60 or more cases per day in average. So you can see that the first peak by that range was not near as severe as what we experienced in October, November, December, and it's trailing back down in December. And so in my mind, it's just interesting to see. I also have I did this for all the numbers for all of Michigan, the numbers for our region, the numbers for Livingston County, Genesee County, Wayne County, Detroit County, Ingham County, the number of deaths per, and this is per 10,000, per 10,000. This is for the whole state of Michigan, 16 deaths, and this is over the whole time. In our region, there were 18.5. Livingston County, as you can see, is 7.2. It's the lowest per 10,000. Genesee County, Wayne County, Detroit, you can see it's very significantly higher. Ingham County, about in our range, and Saginaw, very high. I just wanted to show that, and to me, when you look at the actual figures, I think we get a different picture of this, and I just wanted to share. I'd be happy to share these conclusions, and these conclusions all came from the the Michigan Start database that's given, and I just put it in a format that is more understandable, and so I hope that is helpful. Thank you, Mr. Chairman.
Thank you, Commissioner Helserman. Are there any other commissioners? We wait for Commissioner Helserman to unshare.
Okay. Stop sharing.
There we go. Any other commissioners have any reports? Hearing none, I'll move on in the agenda to item number 11. It's approval of consent agenda items. On the consent agenda that are resolutions 2021-02-025 and 2021-02-026. Is there a motion to approve the consent agenda items?
Motion to approve consent agenda, Griffith.
Support, Gross.
Motion by Commissioner Griffith, support by Commissioner Gross. Any comments? Roll call, please.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent, Commissioner Reader,
Yes.
Chairman Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac.
Yes.
Motion carried.
Thank you. Moving on in the agenda, item number 12, we have resolutions for consideration. This evening, we have 3 resolutions for consideration. The first one is Resolution 2021-02-027. It's a resolution authorizing Livingston County to participate in the 2021 statewide tornado drill. Is there a motion?
So move, Helserman.
Support Plank.
Motion by Commissioner Helserman, support by Commissioner Plank. I would think Therese Cromartie would speak to this. Is she here?
Yes, sir. I am here. Thank you very much. It took me a moment to unmute. This resolution has to do with the support of the Board of Commissioners for county agencies to participate in the statewide tornado drill, which will take place on Wednesday, March 24th at 1 p.m. This is an opportunity to test our community preparedness and resiliency by setting off the sirens at a designated time, and it's going to be done statewide. So our county is participating. What I'm requesting is that you allow county agencies as able to also participate to practice their their plans that they should have in place to protect the employees and any customers that happen to be in the building at the time during inclement weather that would result in a tornado.
Thank you, Ms. Garanti. Questions or comments from any of the commissioners? Hearing and seeing none. Roll call, please.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent, Commissioner Reader,
Yes.
Chairman Nakagiri,
Yes.
motion carried.
Thank you. The next resolution for consideration is 2021-02-028. It's a resolution approving appointments to the Livingston County Board of Public Works. Is there a motion?
Move the resolution. Griffith?
Support Reader.
Motion by Commissioner Griffith, support by Commissioner Reader. Any questions or comments on this resolution? Hearing and seeing none, roll call, please.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent, Commissioner Reader,
Yes.
Chairman Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
motion carried.
Thank you. The last resolution for consideration is Resolution 2021-02-029. It's a resolution calling upon the governor and the Michigan Department of Health and Human Services to retract their SVI social factor-based plan and replace it with a scientific medical factor-based plan that results in a pro rata uniform distribution to Michigan's most medically vulnerable population. Is there looking for
Mr. Chair, I move the resolution.
Support Gross.
motion by Commissioner Zajac, support by Commissioner Gross. Are there comments from any of the commissioners?
Mr. Chair, if I could.
Commissioner Zajac, go ahead.
Thank you, Mr. Chair. I just want to point out a couple of key distinctions in vocabulary as we get ready to take on this resolution. The first one we've heard about is vaccine administration. And vaccine administration deals with the actual putting vaccines in the arms of citizens. And that is being largely controlled and managed by local officials, local organizations, including pharmacies, including health departments, including local healthcare systems. And Livingston County is well equipped to be able to put over 4,000 vaccines in arms per day if that availability was in terms of vaccines was here in the county. But that's not a question that's related to this resolution. The next item is vaccine eligibility. So that deals with different phases that Commissioner Nakagiri just went through in his presentation. That is a criteria that's established by the state. There are certain demographics of folks within our county that obviously meet those different phases. There are 18,000 eligible senior citizens that make up a portion of those phases. But in general, 75% of the eligible population within the county has expressed an interest in receiving a vaccine. But again, vaccine eligibility is not an issue or related in regards to the resolution that we're putting forward. What we are putting forward is a resolution that deals with the distribution of vaccines. And to be very clear, this resolution is in order to support a fair distribution for the most vulnerable people in Livingston County who are not currently having fair access to that COVID-19 vaccine.
And it's really important to understand whether the person seeking access is a 75-year-old white person, a 75-year-old Black person. The fact remains that that person is being treated differently than the same white or Black person that is in another county. That 75-year-old, as an example, Black person in this county is based on the social vulnerability factor plan, being told that they are not equal to a 75-year-old Black person in another county. The virus does not discriminate. We've heard that many times as it relates to age from a statistical perspective. And I'd like to quickly share my screen as well. And what I'm sharing now is the CDC COVID data tracker website. And you can see the URL address at the very top. And this is showing cases by age group on the left in red and deaths by age group on the right. So as it's compared to citizens in this county or any other county, as it relates to age, based on age alone, someone over the age of 65 is 60 or 90 to 630 times more likely to die from COVID-19 than I am as a young person. Likewise, whether it's Wayne County, Macomb County, Marquette County, Saginaw County, the person in that county that is over the age of 65 is 90 to 630 times more likely to die from COVID-19 than I am based on age alone. From there, I recognize that there are contributions such as comorbidities that play a factor in increasing the risk. I also recognize the data shows minority status is a factor in increasing risk, and actually CDC tracks some of that information as well. So on the left, you can see cases by race and ethnicity based on CDC data on the left and deaths on the right, and they track the various race and ethnic groups. So to be clear, those factors should be considered in any medical factor-based plan. The current plan, however, is based on social vulnerability, and the governor admits this, and she says it quite clearly. And this social vulnerability plan does not fairly consider, again, this most significant metric of mortality, which is age. The data is clear, as we can see on the screen. As we compare Livingston County to counties across the state of Michigan, there are situations where very similarly situated population and senior population metrics show that for a county such as Livingston, who has received a total, including the hospital and local healthcare systems, a total of 13,050 doses, barring any sort of delivery today that I'm not aware of. Whereas other counties with the same population, same or similar senior population have received thousands of vaccines more. Our seniors are in need. This SVI plan suggests that our seniors are somehow less than seniors elsewhere. And I understand there's opinions and there's thoughts from folks across the community that are not in favor of this resolution. And to the extent that there's a need to call me or anyone else names or suggest any sort of character fault or faith fault or moral fortitude issue, that's okay. I understand that everyone's allowed their opinion. I was elected, as were the other members of the commission, to serve every person, whether it be a young person, an old person, a fluent person, a poor person, a Black person, or a white person within this county. And I will do that for all citizens, young, old, affluent, poor, Black, white, without hesitation or reservation. I'll be voting a yes on this resolution, and I'm happy to raise my hand, though my employer will probably be mad at me for volunteering for yet another thing, but I will volunteer to assist the state in whatever means necessary to come up with or roll out a fair, medically factor-based plan that, as our colleagues in Macomb and Wayne County agree is no longer based on or used as a social justice tool. And even as our president said, allows for vaccines to go to those who are most vulnerable and those who are dying. And the data, as we see on our screen, shows those, in fact, who are dying are most in the 65 and up age group. So while I or others may be willing to give up my turn in line whenever that may come for someone else, I and others are not in a position to give up that right for our neighbors, that right to have a vaccine. So I will be supporting this resolution, and I think it's very important that we recognize the difference between eligibility, which is set by the state, administration, which our county is well equipped to quickly administer doses in a very orderly fashion, and the difference between distribution, which is the issue of this resolution. Thank you, Mr. Chair.
Thank you, Commissioner Zajac, and I would like to thank you also for your leadership, in shepherding this resolution through the General Government and Health and Human Services Committee. There are other comments from commissioners.
Mr. Chairman.
Commissioner Gross.
Thank you. I echo the comments by Commissioner Zajac, but and I've got a few other points that I would like to make. During the general government meeting last week and call to the public earlier this evening, it seems to me that there's been a fair amount of misinformation in the community. This resolution deals strictly with the distribution of the vaccine. We are aware that there is direct shipments to Myers pharmacies in other counties. Our 3 Myers pharmacies in Livingston County are not on the list for direct shipment. Any doses they get to give out to their customers come from our health department. If there was some way that we could wave a magic wand and have tons of vaccine become available overnight, that would be wonderful. But that's not going to happen. If we could send a Let's bus down to Portage and hijack a shipment for our citizens, that would be wonderful. But it's illegal, and that's not going to happen. And we have been interfacing with the Michigan Department of Health and Human Services since the middle of January, probably even before that. Our Senator Theis on January 13th sent a letter asking what are the metrics, what is being used to determine distribution of the vaccines, and she never got a response. I believe to this day she still has not gotten a response. But then at the end of January, oh, here we go, SVI. And it's very discriminatory to a majority of the citizens of this county. We all hear stories of people getting their vaccines from the University of Michigan Health System, other health agencies, other drugstore outfits. But what is being allocated to Livingston County and its health department and its citizens is pitifully small. And at this point in time, the only thing that we as a county board can do is to pass this resolution and forward it on to the governor and hope and pray that she will react favorably. If she doesn't, there's almost literally nothing that we can do for our citizens. So I will be supporting this resolution, and I hope my fellow commissioners will also. Thank you.
Thank you, Commissioner Gross. Any other commissioners with comments, questions?
Mr. Chair, if I could.
Commissioner Helserman, go ahead.
The call to the public is really my favorite part of any of our meetings because I enjoy hearing everybody's input. And I am happy that in our country, we have the ability to do that. Now, and I would suppose that part of the ability to speak a person's mind is the ability to misrepresent other people's motives and misrepresent what this board is trying to do. We have an obligation to our citizens, as Commissioner Zajac said, of all political parties, all persuasions, all ethnic groups, colors of skin. We have an obligation to do the best for them. And I believe that resolution, the heart and the spirit of this resolution is to bring that to every single person in Livingston County. As I said in the committee meeting, I am for as equal a distribution as possible, though that is not, that's an ideal that's unattainable. I'm for proportionate giving of the vaccine. When I was preparing the reports that I shared with you, if we were going to give a vaccine proportionately, without regard to race, economics, or anything else, we could go by the number of deaths in each county and in the whole state and distribute those by proportionately to the place where they have the most deaths. We also could do the same thing proportionally with the number of cases. So it would be very simple to say, how many cases were in this county and how many cases were in that county, and proportionately give them out according to that. Then we are really doing it by vulnerabilities that have already been proven to be vulnerable. The social vulnerability index makes assumptions that this group is more affected than others, and maybe that is so, but why not take the actual numbers? Why not take the actual numbers, make it very simple? I think that there is no place in our state that when they are lining up people that to get their vaccine, that they are asking them these SVI questions. Why do we want to slow the process down? We want quick and effective means of getting it out. It's kind of like the old question, when did you stop beating your wife? And the question that has been posed to our commissioners is, when are you going to stop being racist? Well, if you haven't been racist, you can't stop being racist. My first boss when I moved to Lansing was a black man. I had no problem with that. I've worked in many manufacturing places in Livingston County, and I have not seen systemic racism in our plants. Some of my best friends and best workers have been black. I enjoy working with black people. I enjoy engaging with black people in conversation. My granddaughter married a person who had a black mother. We had no problem with that. The question is, you say, when are we going to stop being racist? Well, I don't think I have been racist. So, and I don't think this is a racist thing. It is definitely not meant to be that. And I think it's sad if people construe wrong motives to our commission. And I support this. I think that it's, there's no perfect way, but I think that this is a much better way than what the governor has proposed. Thank you very much.
Thank you, Commissioner Helserman. Any other commissioners who haven't spoken to this issue that would like to speak to this issue?
Mr. Chair, may I?
Commissioner Plank, go ahead.
The first thing I want to do is I want to read the mission statement on our website. And this is something that I feel that sort of drives me to try to do the right thing as the commissioner here in Livingston County. And I think it's something that, needs to be looked at on a regular basis to keep focused on why we're doing what we're doing. And that mission statement reads, excuse me, the mission of Livingston County is to be an effective and efficient steward in delivering quality services within the constraints of sound fiscal policy. Our priority is to provide mandated services which may be enhanced and supplemented to improve the quality of life for all who work, reside, and recreate in Livingston County. I think it says it all for me, especially with this resolution, that a part of that are those elderly citizens in Livingston County that we're looking to push for a more fair way of distributing the vaccine. So I definitely, as I mentioned in our last meeting, I plan to support this. The other thing is I spent a lot of my weekend reading a lot of emails. I'm sure most of the commissioners here tonight saw a lot of the emails that came through from the residents of our county. And I believe all but 2 were in favor of us passing this resolution, which then sort of gave me a spark of hope that what I was doing was the right thing, that this is what they want. And then I also spent some time speaking to people outside of Livingston County and talking to them about the SVI. And to my surprise, not one person that I spoke to, and by the way, I spoke to different genders, different age groups, different income status, and none of them had heard of SVI. But the one thing they all said was that they still believe, no matter what, that the most vulnerable group, that if they want to get vaccinated, should be that 65 year and older. So for me, that was just solidifying what I already knew. And that is all I have. Thank you.
Thank you, Commissioner Plank. Any other commissioners who haven't spoken yet to this issue, if you would like to, please let me know. Otherwise, I want to address the issue. But as chair, I will go last. Looks like it's my turn. So I am going to present some information. I'm going to share my screen. So I want to give you my take on this Michigan COVID vaccine rollout policy. I say Michigan follows the social science, not the medical science. I want to go back to early last year. I think it was the first quarter, end of the first quarter. The governor formed Michigan Economic Recovery Regions, through its, which actually one of the presenters that called the public had mentioned this. And so this, I'll just read it. The council also carved the state into 8 geographic regions based on worker travel routes and the proximity of healthcare facilities. The health risk of each region will be determined by tracking the trend of positive COVID cases, et cetera. So I want to focus on these regions were designed, and we were told counties were grouped together because they had similar health risks in these regions. So here's a map of the various regions. Down here is region 1. It's the Detroit region. Where the red dot is Livingston County. But you can see the geographic regions. I will point out up in the UP is region 8. And then in the northern lower peninsula, it's region 6. So back in June, and this is from an MLive article on May 6th, I added the highlighting, but these are direct quotes. Starting on June 10th, regions 6 and 8, which include much of northern Michigan and all of the upper peninsula, will be advanced to phase 5 of the governor's Safe Start plan. So those regions were treated equally, region 6 and region 8 when they moved to phase 5. In contrast, the other regions were not deemed to be as far along in terms of COVID progress. So the remaining regions 1 through 5 and 7 were going to remain under phase 4. And that goes along with the governor's stated purpose of treating regions with similar health risks to treat them similarly. The MRC, Michigan Economic Recovery Council regions were established based on health risks, not social risks. The governor specifically placed Livingston County in the Detroit region, saying our health risks were the same, even though our COVID numbers were far better. In her estimation, the risks were the same as Detroit, Wayne County, Macomb County, Oakland County, and many others in the Southeast Michigan region. So we had the same COVID mitigation for all. COVID mitigation was the same for all citizens. So I ask the question rhetorically, why wasn't SVI considered? Why do we treat everybody the same? If you believe in SVI, we shouldn't have been treating everybody the same with respect to mitigation. And some of the mitigation, the more important ones that have been that everybody's familiar with: wash your hands, social distancing of 6 feet, wearing a mask. So COVID mitigation was also the same for all businesses and schools. Why wasn't SVI considered then when businesses and schools came into play? They all had the same capacity limitations. They all had the same sports limitations and education limitations. So it was one size fits all. So as I said, COVID mitigation did not depend upon SVI. We had equal mitigation treatment, regardless of socioeconomic status, regardless of household composition and disability, regardless of minority status and language, and regardless of housing type and transportation. All mitigation was treated the same. So as a question of fairness, I just would like people to think about this. If it was a best practice to impose the same mitigation for all citizens, why is it not a best practice to provide the same vaccine access for all citizens? I just ask people to consider that question and think about that. The social vulnerability index has been talked about. I want to elaborate that a little bit more in detail. What you're looking at are jurisdictions in the MERC Detroit region. So these jurisdictions include all of the counties listed at the bottom of the page, and along with the city of Detroit, which is listed separately from Wayne County. And so what you're looking at are the social vulnerability index scores. On the far left in dark blue, Livingston County at 1.02 index, and over on the right, the city of Detroit with a 2.0 index. I would also want to point out to you that our 1.02 index is very similar to Oakland County at 1.04 and Washtenaw County at 1.07. I want you to remember that because it's an important point in subsequent slides. So in terms of vaccine rollout math, Livingston's SVI is about half of Detroit's SVI. So you take that 1.02 divided by 2, and it's actually 0.51, but it's actually, well, it's close to a half. Therefore, Livingston will receive about half as many doses, vaccine doses, as Detroit, and that's based on a it's kind of like per capita, but it's not per capita, it's based on target population of medical personnel, first responders, essential workers, elderly, teachers, etc. So we would receive half as many doses because of this SVI formula. So according to SVI, Detroit has twice the risk as Livingston County. Shouldn't those that advocate for SVI consider the following? That Detroit has twice the risk. Why didn't we consider social distancing of 12 feet in Detroit rather than 6 feet? Or requiring 2 masks rather than 1? Or a restaurant capacity of 12.5% instead of 25%? Why were there no differences in maintaining school sports lockdown? Or why didn't we have requirements for more frequent hand washing? Those are questions that legitimately ought to be posed to the administration. Did they not care enough about those in Detroit to give them the appropriate mitigation given the SVI was twice the risk? I want to talk about Michigan vaccine rollout math because there's some problems here that perhaps extend beyond SVI and into how the administration is deciding to dole out the vaccines. So in 3 counties, they're all in the same Detroit region. They all border on one another. Livingston, Oakland, and Washtenaw have approximately equal SVIs, 1.02, 1.04, 1.07. If one believes in SVI, then these 3 counties should receive approximately equal quantities of vaccine doses adjusted for population. And at most, down below, they shouldn't vary by more than 4.7 or all rounded up to 5%. The doses ought to be pretty close on a population basis. But in fact, they are not. These 3 counties, Livingston, Oakland, Washtenaw, if you look at the number of doses on the vertical scale per target population, Livingston has 0.39, Oakland has 1.15, and Washtenaw has 1.59. In red, you'll see Washtenaw, and these are counties with very similar SVIs, has 400% more doses than Livingston. Oakland has 291%. So that's 4 times more and almost 3 times more. There is something wrong with what the governor is doing in terms of allocating vaccines to Livingston County. We are getting shortchanged, not just seniors, but all the citizens in Livingston County. And that, like I said, that could be beyond just problems with SVI. So consider this, if you're an advocate for SVI, Livingston has received 13,050 doses. If we used Washtenaw as a benchmark, saying Livingston County really should have received on a per person basis, about the same as Washtenaw, but in fact Washtenaw is 4 times more. So if you multiplied our 13,050 by 4, we have 52,200 doses, or enough to vaccinate another almost 20,000 people. So those are real lives. Those are real people that are being impacted by decisions of how to dole out vaccines made by the administration in Lansing. In summary, COVID policy was supposed to be uniform throughout an MERC region. It is not. Michigan, as it was mentioned earlier, does not follow CDC vaccine rollout recommendations. And whether one believes in SVI or not, Livingston County clearly is not receiving its fair share of vaccines. That's all I had to say on my presentation. I'm going to stop sharing in return and see if there's any follow-up questions, comments from any of the commissioners on this issue. Commissioner Reeder.
I just want to make kind of a blanket statement. Controversy is a great thing. And in this country, we are blessed to be able to do that. We've witnessed a lot of different points of view today, and it's a good thing to know what they are, but we still have to weigh everything out. I have to give a lot of praise to Commissioner Zajac and our chairperson for taking the time and effort to come up with all of the factual statistics that go along with us wanting to support this proposal. It's not being made politically or because of any other reason, nothing to do with race or social status. As you can see from the presentations here tonight by Commissioner Nakagari, the facts and figures are there, showing that we should be challenging what Michigan has done. And it doesn't mean that by passing this that we're going to get what we want. It just simply says we're challenging it. I'm trying to point out to the governor that maybe she needs to take another look at what she's doing, because there is an impact on various citizens. And it's not only Livingston County, it's throughout the state. So it's an important issue. I appreciate everyone's point of view and keep it coming. Thank you.
Thank you, Commissioner Reeder. Any other comments? I would like to take a moment to put forward for consideration an amendment to this resolution. It stems from the comments about you know, we can call on the governor to make these changes. She may or may not listen. I think that that concerns me. I think we ought to evaluate other options. I'm not saying, you know, what we're going to do in the future, but I'm saying we need to have more options available for consideration. For that reason, I am going to put forward the following amendment to be added to the end of the resolution. The following amendment. Be it further resolved that the county administrator and county corporate counsel are directed to investigate and report to the Board of Commissioners by March 1st, 2021, possible administrative appeals and legal avenues to compel the state of Michigan to protect our most medically vulnerable citizens by fairly allocating vaccine doses to counties based on proportional vaccination phase population estimates and not based upon non-medical or social factors. So I am putting forward that amendment, and is there a second?
I'll second it. Reeder.
Second by Commissioner Reeder. Is there any, procedurally, I want to take comments, questions on the amendment. We'll then vote on the amendment, and if the amendment passes, we'll include it into the resolution for the final vote. So are there any questions or comments on the amendment? Hearing and seeing none, roll call please on the amendment.
Chairman Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent, Commissioner Reader.
Yes.
Carried.
So the amendment passes. So unless there are any other questions or comments, we'll call for a vote on the amended resolution. Ask one last time, questions or comments on the amended resolution? Hearing and seeing none, roll call, please.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent, Commissioner Reader,
Yes.
Chairman Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick.
Yes.
Motion carried.
Thank you. So we are at the second and final call to the public. If there's anybody wishing to address the Board of Commissioners this evening, if you would use the raise your hand function on Zoom or wave your hand at us, you'll be recognized. Please give your name and address prior to speaking. You'll have up to 3 minutes to address the board.
Lynn Vogel.
Hey there, Lynn Vogel, 415 Northeast Street. This isn't going to be as cool of a presentation as I gave you guys earlier, but I hope it, I hope it gets something off my chest. The whole speech of fairness and vulnerability. I had to chuckle. Why didn't we ask people in Detroit to stand twice as far away from each other? Maybe because they couldn't, because they were in crowded living conditions. Why didn't we ask other people to wash their hands more frequently? Maybe because they didn't have access to clean water. The fact that age is taken into consideration in the SVI is there. It is given a weight, and it's given a good weight, but that has to be balanced against the fact that equal ages are not going to be at the same risk of infection as each other, right? So if an elderly person in a compacted living environment is set against a person in a single family home or that lives by themselves out in the middle of nowhere, we want to give the vaccine. If we only have one vaccine, that's our case right now, it's a vaccine shortage. If we only have one vaccine, we're going to give it to the person that's forced to be around more people because those people are potential carriers. They're at greater risk of infection. And if they get infected, yes, their age indicates that they have a very high chance of mortality or morbidity. So the vaccine shortage is what's causing the issue that requires the SVI, not the pandemic itself, not the factors that can mitigate the pandemic or mitigate infection, things like social distancing, mask wearing, things like that. This covers who do we send vaccines to? We kind of have to guess. Really, at this point, we've got a limited supply and we have to guess to try to prevent people from getting infected. I like the idea of using actual death numbers, like the factual numbers of people that have died. The problem is that they're already dead and we can't vaccinate them. So we have to try to guess who has the greatest risk of dying, both medically and whether that medical issue is going to be exposed due to social factors. That's the SVI. I mean, going purely medical equates the chances of getting sick and dying between a compacted living arrangement and a single person living arrangement. They just treats them equally. It's pretending like that difference doesn't exist. Does that mean that the person in a single living arrangement is less than the other people? No, of course not. We just know that the other person's probably going to get sick before the single person does. So, I mean, that's what it is. And that's why going by purely medical isn't going to cut it when we're trying to guess where to send vaccines to. Eventually, everybody's going to get one. I mean, I hope, unless we stop pushing for vaccines, but who knows?
Thank you, Mr. Vogel.
Jim Anderson.
Yes, Jim Anderson, 84 Cranbrook Drive, Marion Township. I'd like to thank Commissioner Zajac for his leadership surrounding this resolution tonight. I think it's a good thing that we're pursuing this at the state level. As Commissioner Zajac and the other commissioners have noted, this is really a two-pronged problem, actually a three-pronged problem. Supply, which none of us can really influence at this point in time. Distribution, which we're talking about tonight, and then administration. So really the two that we need to focus on is distribution and administration. Believe me, administration's as big a problem, if not bigger than distribution. And that's coming quickly with the advent of the approval of the Johnson & Johnson vaccine. I think that's going to open things up dramatically. Also on the distribution front, it was interesting to hear tonight that the state is dictating where the vaccines are going within the pharmacy network, and I'm sure the healthcare networks. I assumed that was going on, but tonight I heard that it was going on. So the folks that believe that, okay, the health department is only 10% of vaccination opportunities, believe me, the state's controlling all of the distribution of the vaccines within the state. Let's see. I think that's really all I had. Thank you very much. And thank you again, Commissioner Zajac.
Thank you, Mr. Anderson.
Leo Hannafin.
Yes, I'm sorry, I didn't hear properly when you first said my name. I am still Leo Hannafin. I'm still in Brighton Township. And yes, I'm the one who suggested some education and introspection about racism. And I'll stick with that recommendation. Saying that non-English speakers are not Americans reflects great racial insensitivity, if not racism. White people who are uncomfortable discussing race quickly get defensive. Some of the most popular videos on race and racism in America focus on that discomfort. One by Robin DiAngelo even describes a predictable script that reflects that discomfort. They quickly say, I'm not a racist. Some of my best friends are Black. I work with lots of Black people. My second cousin married a Black person. Commissioner Heltzerman could have been reading from that script tonight. Until recently, I might have sounded just like that. I raised scholarships for minorities. I secured $30 million grant for Focus Hope. But more recently, I've become more aware that systemic racism and implicit racism are alive and well in America and in our county, as demonstrated by recent happenings at a local church and with local realtors. And my silence constitutes complicity. So I'm beginning to speak up, and I'll continue to do so. I was also taken aback a bit by comments by other residents and speakers tonight who were speaking about those who were speaking against the resolution as being organized political activists. Well, if that were true, then we're in the right place. Policymaking body that represents us. Those who opposed the resolution were also characterized as, quote, not real. We got to hear from some real people. Well, I'm a real scientist. I'm a real 74-year-old cancer survivor. I was dean of the College of Engineering and Science at the University of Detroit Mercy for 21 years. And much of my research for 50 years was in areas based on probability and statistics and modeling. For situations like trying to distribute vaccines to the most vulnerable first, weighing certain factors higher, the factors that have the most influence, is in fact the scientific way to develop such an index. Distributing vaccines based on only one factor, such as age or population, would be one of the very least scientific ways to develop an index, especially when factors are known to have significant influence on vulnerability. Commissioner Zajac's supposed concern for the 75-year-old Black residents in Livingston County is laughable, as was his analysis. He failed to represent the data accurately, and I could point out several ways in which he did so. If he's going to be developing a index for us, I think that we should be looking to the experts in the state and CDC instead of him. Thank you.
Thank you, Mr. Hannafin.
Jessica Garcia.
Hi, again, I'm Jessica Garcia, 327 South 3rd Street, Brighton. As I mentioned earlier this evening, I'm here as a resident, but also as a diversity, equity, and inclusion consultant. And I think it's important to emphasize to folks that equity is not equality. It never has been, it never will be. It's about equal access for equal outcomes. And what has been emphasized tonight over and over again is what is fair and what is equal, and that's not how equity works. The other thing that's come up multiple times is kind of a lack of acknowledgement on what an essential worker means. These are people who work in our grocery stores. These are people who drive our public transportation. These are people who work in our restaurants. All of the businesses that we claim to support and want open, they can't do this if they're sick. They can't support their employees if they get sick long term. I think it's really short-sighted to be focused only on the residents in our county and not thinking about the detrimental impact this is going to have on our entire state. This is a waste of resources. By the time this gets to the governor's desk, by the time there's a response, there will be vaccines for everyone. I'm so disappointed in our board tonight in the posturing. This is absolute politics. That's all it is. It's not going to accomplish anything except for to have your voices heard. And it is heard in the most thoughtless and selfish way possible. If you want to be a county that attracts new residents, you have to show them that it's worth living here. And right now you've given them nothing to help people think that we care about them. We care about our state. We care about our communities. I'm so disappointed tonight. And the fact that the board just unanimously dismissed all of the folks that are here tonight, we're not here for controversy. We're here because we care, and we're absolutely disappointed in your lack of leadership tonight.
Thank you, Ms. Garcia.
Leanne Blaze-Drewski.
Okay. Yes, hello. I'm from the city of Powell, and I wasn't gonna come back in, but I'm going to because I want to make a comment about the previous speaker statement. So I'm a registered nurse also for over 30 years, and I also have advanced degrees in public health, in nursing, and I'm a PhD in public health with a specialization in community health. So I am trying to explain to people in my community that the big problem that I personally see in my work is the deaths that have occurred among the seniors in Southeast Michigan, because that's where I work. I cover a large area in Southeast Michigan. I gotta plug my computer in. And we experience a lot of deaths among the senior elderly of all races, of all genders. And it was regardless of their state of vulnerability. When they contracted the COVID-19 virus, there was a very high likelihood they were going to die. I had very few people in their 90s that survived COVID. I had a couple, shockingly, that were both 98 years old that survived. And so that was just a miracle. So I do understand social equity and all and what that entails. I'm looking at this using plain old common sense. My common sense tells me, in my experience as a registered nurse and public health expert, that if you have the large majority of people who are susceptible to serious complications if they contract this virus, well, that's who we have to focus on. That is where we're at with this. Thank you.
Thank you.
Are there any others in the public who would like to speak who do not have the raise your hand function? Please wave. Nancy Durant.
Hi, I'm just going to say something with
respect to, I think, the people that also have some concerns about fairness. And just make a suggestion. I don't know if people know, if you have friends and family who are having difficulty trying to reach and get vaccines, please call 211. For those of you who don't know, that's an option for trying to get help through MDBH for getting vaccines. We don't have enough vaccines now. We know that, but there will be. We know that, as I said before, hopefully by the end of March, beginning of April, we will have had enough vaccine for everyone that's over 65. And I'm just going to reiterate again. I know, Wes, you did put forward a slide that talked about what we've got in Livingston County, what we've got in Oakland, and what we've got in Washington, and what we've got in Wayne County for vaccine. I'm just going to reiterate again, and it's in the resolution that there were 6,300 vaccines that were given to Livingston County. That is not all the vaccines that were given to Livingston County residents. I would really recommend that you look at the number of people who are actually vaccinated in Livingston County, and do not use that number as the number that you're putting forward in the resolution. That is not a correct number. I can't give you that number exactly, but I know that there are many more number of people that were given through IHA, were given through Beaumont, were given through Michigan Medicine, were given through Ascension, that were people in my neighborhood. So please don't use the number of 6,300 as the people that were vaccinated through Livingston County. Thank you.
Thank you, Ms. Ernst.
Are there any others who would like to speak a call to the public? Please raise your hand. Commissioner Nakagiri, I do not see any other hands raised.
Thank you, Cindy. I will go ahead and close the call to the public and move on and ask, item 14 is adjournment. Is there a motion to adjourn?
So move, Helserman.
Support, Griffith.
Motion by Commissioner Helserman, support by Commissioner Griffith. Roll call, please.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac, Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence is absent, Commissioner Reader,
Yes.
Chairman Nakagiri,
Yes.
motion carried.
We are adjourned. Thank you to everybody for joining us. Appreciate the discussion. Please join us at a future meeting. Thank you.